So I led on a panel of UK neurologists, pharmacists, an immunologist and infectious disease specialist who all came together to think about infections in MS. And of course, probably the most relevant aspect is the relationship between disease-modifying therapies and infection in MS, although there are lots of other links between infection and MS. For instance, the EBV story, about etiology of MS, the fact that infections can sometimes trigger relapses and so on. But really the focus of the guidance was helping clinicians to try to mitigate the risk of infection when they're prescribing disease-modifying therapies. So, we looked at not only the SMPC data, but we also tried to scour the literature to understand what the real risks are of things like tuberculosis, where sometimes we're screening people before putting them on medications, understanding what the false positive and negative rates are of that, particularly false positive rates, and whether that might mean exposing someone to potentially toxic anti-TB therapy needlessly, or giving them a DMT, which is other than you might have preferred unnecessarily. So we looked at those sorts of pitfalls. We looked at some of the things around things like the herpes viruses like HSV and VZV, how to mitigate those risks. And we also looked at things like vaccines, which have obviously become quite topical during the COVID pandemic, and just gave some recommendations around there. So there was a sort of robust review of the literature, followed by a series of individual recommendations that were evidence graded. I would encourage people to go and have a look at those.